text neck.
Mm.
Text neck, huge, I would say pandemic in the world
Absolutely.
is anterior head carriage,
Absolutely.
which is your child holding their head too far forward on
We're
their
talking
shoulders.
kids, but this is like relatable to everybody.
Yeah.
But if you think about it, if that gyroscope is above
Yeah.
our shoulders where our head is sitting, but if our head is constantly forward, because if we bring this back to that text neck, how can our body best adapt and live in this world of when we're supposed to be able to navigate things?
Yeah, if it's constantly forward up top, then what's going to happen is on the bottom, it's going to adapt and compensate and pull you back. So you may be perceived as standing upright. Our head's not on straight, literally. It's not where it's supposed to be. So now we see all of these symptoms culminate because our upper neck isn't in the position it's supposed to. So this forward head carriage, this change in posture, not okay. And these guys right here are the primary culprit now. Welcome back to the Prime Podcast. I'm your host, Dr. Skip Wyss, and I am with, as always, the fabulous Dr. Fairy Fingers herself, Dr. Julie Wyss.
Good morning.
How are you today?
I'm great.
Yeah, that's fantastic because I'm doing pretty good too. Now, let me ask you a question, Dr. Julie. Last week, we talked about posture. We talked about kids' posture, what they're like going through that whole gamut of development to where they're talking and standing on their feet and doing their stuff. And then the number one comment we hear from parents is, stand up, sit up straight, do all of this. But I really want to delve into the old common adage of text neck. Text neck, huge, I would say pandemic in the world.
Absolutely.
Is anterior head carriage.
Absolutely.
Which is your child holding their head too far forward on their shoulders.
We're talking kids, but this is like relatable to everybody.
It is relatable to everybody. Yeah. It's one of those things that as a parent we see in our kids, but even more importantly as adults we see it in tons of adults. We see it in everyone across the board. And this anterior head carriage, this anterior posture, they're forward, their head's coming too far forward. I just don't want to mess with the mic volume. And we see it all the time in children and in adults. And one of the biggest culprits to all of this is these things right here. These devices, right? Having these in our hands, always looking forward, always looking down. But it's not just cell phones that causes this. You know, we see it in teenagers a lot. We see it in kids that are in college, from reading books to being and studying all the time, having things down in front of us, from laptops to computers to all sorts of things. And it's not allowing our head to sit upright posturally on our shoulders properly. So what happens is we start coming forward. And then our body tries to keep up and lean us back, which then causes low back problems as well. In fact, according to the American Academy of Pediatrics and the American Academy of Physical Therapists and of osteopathic medicine and also of orthopedists, they all state in research that for every 1 centimeter that your neck comes forward off of your shoulders, you add an extra 35 pounds of pressure to your low back. 35 pounds. Most of the time, people have an anterior head carriage of over 1 inch from their shoulder blades.
It's a lot of centimeters.
It is. It's 2. Okay? And it adds 75 pounds of pressure to their low back. Now, I want you to think about this out there. If you lived your whole life from, let's say, 3 years old on, where your head was too far forward, and I want to lean into my mic, keep going like this, but your head's too far forward, and let's say it's even 1 centimeter forward, and you're carrying an extra 35 pounds of pressure your entire life, do you think that over time that your low back will compensate and develop problems?
Absolutely.
Do you think that an alarm could go off?
Absolutely.
In the form of pain? Do you think that it would affect you, women out there, during your pregnancies?
Absolutely.
Absolutely. Because you're causing all of this tilt. And in fact, when we know this as chiropractors, over 16 years of working here at Prime Family Chiropractic Center, we see this so commonly. I would say it's prevalent in 97% of our patient population.
I'd agree.
Yep.
Absolutely.
Anything from kids that are walking. Now, we see it develop when children are born. We can see this during the birth process when there's ever trauma to the cervical spine, to the neck, when a child's maybe pulled out, pushed around, whatever it may be. But then from that point forward, when we don't have that right communication, when our head is not on center, the body just compensates the rest of the life.
It's really smart.
It's really smart. So now we get this anterior head carriage. And what we will notice is children, when they're in their early years, 2 to 3 years old, they will start developing ear infections. We see this all the time where we'll see a change in immune function. We'll see a change in behavioral issues. We'll see all of these things happen because we don't have the proper communicating nervous system. So now the first thing that we see on the outside, though, is that postural change. And we'll see that anterior head carriage. And that is not okay.
Yeah, and I guess to think that, oh gosh, just my child's shoulder is one's higher than the other, or their head is rotated or tipped one way or another, that's what's causing my ear infections. That's what's maybe, exacerbating my asthma that my child has or I have, or during pregnancy, or even infertility. That all of these things that we can see from the individual. Now everybody's going to be like, when you see somebody, you're going to look and be like, ooh, I bet you have this going on.
Well, now they're thinking like chiropractors.
Exactly. But like that's where like our body shows us outward things. So when we're talking pediatrics, when we're talking our children, when they can't say how they're feeling,
right,
or what's bothering them, we need to be able to look and assess and like, granted, you're not all chiropractors, but to be able to see that little window of, okay, my child maybe looks a certain way or something just seems off, like trust that, right? And that's why there are professionals, like that's what we are here to be able to do, to give that correct assessment, that examination of like, you're not crazy, like this, we are seeing the same exact thing, and this is why your baby isn't sleeping at night. This is why your baby maybe has severe colic or reflux or constipation or is just always irritable.
All of those symptoms.
Because they're not feeling good.
Yeah, because their body's not functioning like it's supposed to be. It's not communicating like it's supposed to. And if we are, let's use this as an example. Let's say that our body has a value of 100, okay? And don't worry, stick with me because it's going to make sense. Let's say our body has a value of 100. And of that 100, 50 points goes to posture all day. And it should just be sitting at 50 points. But if my body has to try to correct posture all day and take points away from other areas, so now instead of it being a 50-50 split, now I'm taking points away. Let's say I take another 25 away. So now I'm 75 of my points are actually trying to fight gravity and posture all day and keep my head on straight. Only 25 of those other points can go to other systems: cell function, nervous system function, immune function,
sleep,
organ function, sleep, all of it. So if I'm fighting gravity all day long, and 75% of my resources have to go to just keeping me upright every day, when really half of them should be going to organ function and cell function and allowing me to digest food, maybe fight off a cold or a virus that comes in, maybe process food and actually go to the bathroom on time or normally throughout the day, it just robs it away. So do you think that your body is going to function normally after that point?
Absolutely not.
Absolutely not. So why are we not doing, as a society and as parents out there, why are we not doing everything in our effort to try to keep our bodies functioning and keep our kids' bodies functioning the best that they possibly can be? And we haven't even gotten into personality and neurological development. And all of that stems out. And then what do we see as a result when they're between 10 and 13? They start sitting like this. And they start, hunching forward.
And I'm sure, I mean, because we love everything about the brain, right?
Yeah.
I'm sure we're probably going to get into this, but
Yep.
That's why we wonder why there's such a prevalence and an incidence of learning challenges, right? Why there's such an incidence of mental health in the world,
right?
Mental health problems,
Yep.
not being able to, observe and be able to react in an appropriate manner in the world that we live.
Okay.
And sleep, like we talk so much about sleep, right? So our body is super smart in that it gives us these issues, which we're really good at giving a medication to.
at
but
times.
it's
Yeah.
not going to solve, unfortunately, the true root of what's happening.
Yeah, and trying to get that back. So when we see their parents looking at our children and we see these postural changes or this anterior head carriage or them coming forward, that's their body screaming out that it's trying to compensate to try to keep itself functioning and those organ systems working. Typically, little girls should be getting, or adolescent girls should be getting their period between what, 12 and 14 years old, right around in there, not 9 and 10. And when that happens, when we start seeing girls become more fertile earlier in life, that's a problem with communication. That's the body not being able to run the program it's been designed to run, which is completely regulated by their brain.
Absolutely.
And so if I don't have the right communication, I can't run those programs. So if we see a young girl develop a menstrual cycle extremely early, that changes her hormone pattern in her body extremely early. That's not okay. It's not fitting the normal developmental timelines. And we've seen this change in food and hormones and all these different things coming into the body. And then the body, being super smart, now compensates to that external stress and starts developing things way too early.
It's going to process the environment that it's being placed in.
Yeah, exactly.
But that doesn't mean that it's the right time and the right place for that to be happening.
No, it's not. So when we start seeing that, and generally we'll start seeing another thing come in early on in childhood, and that is headaches and migraines. And we see it in adults too. But the funny thing is that when we ask an adult, how long have they been suffering from headaches and migraines? Generally, what do they say?
They usually go back to how I grew up with them. I've
Yeah.
had them since I
Had
was
them my whole
grade
life.
school.
Yeah, these are just my normal headaches. These are my weekly headaches. Or these are my hormonal headaches. Or these are this and that.
No headache should be normal.
No, we should have a life without headaches. I rarely get a headache, and so do you. But when they happen, they suck.
Yeah, but then we also know, gosh, like we've been taking care of everybody else. Are we taking care of ourselves?
Are we taking care of ourselves? Do we have a fully functioning and communicating nervous system, which is the key to all of this? Do we actually have the body properly adapting like it's supposed to? So when we see these things delay us or set us back, like a headache, or our body's telling us these systems of alarms, like it's giving us pain, we need to pay attention to that, but then find out why. Find the malfunction in the body and restore the function. Not just make the pain go away, because we've even had that ourselves, where you've adjusted me and I've had a headache. You've checked me. You found the areas that needed to be adjusted. And then within hours, we'll start seeing a change in those symptoms. Not minutes or seconds. It takes time. But the body will start to heal it exactly how it's supposed to. And in the time frame it's supposed to heal. I don't want to rush it. If I rush it, it ain't going to heal properly. Right. If I delay it, it's not going to heal properly as well. Same thing with fevers. If I rush or take away a fever, that delays the body's healing response. So we have to let the body take its place
on its own terms,
in its own terms,
not what's going to be best for what we think that it needs.
Exactly.
We can't we can be really, really smart. We can have the highest IQ, but our body is still always going to be smarter than us. It knows exactly what it needs to do. We just need to get out of the way to allow it to do it.
Now, we'll also see a change in children's balance, like their ability to be coordinated, like coordination. That's a big one. Not just the balance of the postural muscles, which is what we talked about in the podcast previous to this one about posture, but this one on anterior head carriage, we'll notice that, or forward head carriage, we will notice a big thing is their ability to stay balanced, their ability to be coordinated. And when we have a child that's not coordinated, from right to left, left to right, can't stay upright, seems to have the balance of an egg, always falls over, always bangs into stuff. And we're not cats. We don't have whiskers, right? But our body does have a sense of itself inside of its environment.
It has like the gyroscope, right?
But
if you think about it, if that gyroscope is meant to be like, I don't want to say top of our head, but like,
it's above your shoulders.
Above our shoulders where our head is sitting. But if our head is constantly forward, because if we bring this back to that text, Nick, how can our body best adapt and live in this world of when we're supposed to be able to navigate things?
Yeah, if it's constantly forward up top, then what's going to happen is on the bottom, it's going to adapt and compensate and pull you back. So you may be perceived as standing upright, but you'll be constantly having low back pain. You will constantly have pelvic issues, whether it's menses issues, bleeding problems, cramping, all of this. Your boys develop Osgood-Schlatter's, and they develop pain into their knees and legs.
Yeah. Growing
pains, foot pain. They'll have tightness in their IT bands. They'll complain to you of low back pain and achiness, all in their teens. And that is a direct sign that we don't have the right communication. But even more importantly, our head's not on straight. Literally, it's not where it's supposed to be. So now we see all of these symptoms culminate because our upper neck isn't in the position it's supposed to. So this forward head carriage, this change in posture, not okay. And these guys right here are the primary culprit now.
Absolutely.
But this has been something that's been around for decades.
They're not going
Smartphones
away.
have been around since 2004, 2005. They're not going away. But guess what was there before that? Books. Computers before that. I mean, books before computers, obviously, but computers before smartphones. So we've always had the tendency to be looking down. What was one of the coolest things in chiropractic school that we had when we studied? Do you remember those?
So I had a book riser.
The neck saver,
right?
Yeah.
So again, just like, well, there's always been books. How come this is such a big thing now? Because I don't know if it was just passed down, but when you had a book, like you held it up to your face.
Mm-hmm.
Right. So I don't know like what's happened. Again, people get lazy. Like we all get lazy.
Mm-hmm.
We're all prone to do that. But maybe our phones are just that heavy, right? But when our book is supposed to be here and then we do this, right, our head is going to follow it. So yeah, we use neck savers. So even like you set your recipe cards on when you're cooking, all it is just a stand to hold whatever thing that you're doing, if
book
it's
stand.
that phone, if it's your book, to bring it up, so then your vision is straight at it, so then you can keep your head in a neutral position.
Yeah, and this brought me back to one other thing. We both did music in high school. We both played different instruments. I was saxophonist. I like to call it the sexy phone. You know what I'm working with. And then were you a flautist or a clarinetist?
Flute.
You were a flautist. Okay, so you played the flute. Okay, but where did you hold your music? If it was
up in front.
Yeah, if it was down in front of you, what happened? It changed the way you could breathe.
Yeah, especially.
Especially with flute, right? I don't even know how you play the flute like this. Saxophone, you had to tip a little bit, but everything had to be upright in front of your face, so you stood up. Same thing when we're singing. I was also a singer in high school. I had to bring my music up, not cover my face, but bring my music up so we could get the proper airflow in.
And I find it, since you're bringing that up, like sometimes I wonder when we sit and we watch these concerts, right? These choral endeavors, and why these kids aren't bringing their books up, or why they're not instructed to do so, is because they can't.
Yeah, they can't. It hurts them.
They can't actually bring their head up. So we already know that these children have developed a habit, a bad habit, of singing with their necks in a downward position, right? So then we wonder why maybe we're not always on key, or why we can't hold a note as long. But then I immediately go to, well, dang, we know down the road they're going to have sleep apnea. They're not sleeping appropriate at night, which then we then know that, well, that's why they're always sick. That's why their body isn't healing. That's why their immune system, is in the garbage can. All because of just this slight movement of bringing our heads up for proper alignment.
Bringing everything back to where it stinking belongs. Man, this has been a good one, because this all comes back to alignment of our upper neck, comes back to the birth process, comes back to those early developmental habits that we develop between 0 and 2 years old. But then all of these symptoms that we deal with as adults, teenagers, adults, all comes from our childhood. Hence why Julie and I are always on a mission to take care of as many children and pregnancies as we possibly can. We're on a mission to reach as many people in the world as we possibly can, and making sure that this podcast gets out to as many people so we can directly help parents find the right things for their children. But we know that chiropractic is the center of all of that.
I know, and I'm just thinking in my head, I'm singing it right now. Who the heck wrote the song of my shin bones connected to the knee? Like, right? If we could just go back to that, of realizing that it's so true that everything is connected, right? That's structural. But then we have all of the internal stuff that's responding to what we are doing to the structure. So unless we get our structure under control, right, we're not going to have that strong foundation. And then we're always going to be dealing with all of these side effects and aches and pains and symptoms that everybody has come to think that it's a normal part of life.
Yep, and I didn't get into this profession to treat people's symptoms. I got into this profession to help people become healthy, stay healthy, heal like they're meant to be, above, down, inside out,
Live and thrive.
and live and thrive. So, everyone out there, Dr. Julie, you have anything else you want to bring up today
Singing my
involving
song.
text neck and your knee bones and shin bones and shoulder bones? So, if you love what we had to say, give us a thumbs up, give us a subscribe. We would love a 5-star review inside iTunes if you could help us there, or leave us a review right here on YouTube as well. Just share this with as many people as you can, and we love you. We appreciate this. Go out there, get it done, and we'll see you all next week. Bye, everyone.